Hello, I'm Mary Beth Bender. I'm a family nurse practitioner and the director of the UW Student Health Service. Our successful management of COVID-19 depends on as many people as possible pulling together using science-based, evidence-informed measures to reduce the spread in our communities, our state, our country, and the rest of the world. Several of my colleagues have already addressed the evidence behind some simple yet very important measures that you can take. If we hope to see an end to the pandemic and minimize ongoing business closures, school closures, travel restrictions, and the effects those have on our daily lives and the economy, we need everyone to pull together. Mask wearing, responsible social behaviors, like not going to work or school when you're sick, washing and sanitizing your hands often, avoiding events where there are large numbers of unmasked or unvaccinated people, and vaccination for those who are able to do so, not only protect us as individuals, they protect those who cannot be vaccinated and those who have conditions that make them much more likely to have severe illness. You likely have family and friends who would fall into those categories, like infants and small children, the elderly, including your grandparents, people with cancer, people with lung or heart disease, people with diabetes, people who have undergone organ transplant, or people with autoimmune conditions who need to take immune suppressing medications. However, even people who do not become seriously ill can suffer financial difficulty from getting COVID when they have to miss work or because they're sick or they have to care for sick family members. Parents of unvaccinated young children may have to miss work or school to stay home with sick or quarantining children. In addition to protecting you from serious illness, being fully vaccinated means you do not have to quarantine if you're exposed to someone with COVID-19. As long as you do not develop symptoms, you just need to wear a mask when you're around others and monitor for symptoms for 14 days. This means that you are not missing work or school. Wearing masks and getting vaccinated can also mean increased freedom. Freedom to do many of the things that currently require one or both of these, such as airline travel, attending concerts or shows where they're required, or other venues. For some of our UW students, it could mean more opportunities for internships and other experiential learning opportunities like clinical placements in businesses outside of UW's purview that may require them. It also means that you wouldn't have to miss traveling home for the holidays, winter or spring break, and other important events because you have to quarantine here in Laramie after being exposed to COVID. Wearing masks and getting vaccinated can save you time and money. If you have to miss work or school because of an exposure to COVID and you need to quarantine, you lose money if you can't go to work. If you have to quarantine multiple times in a semester, it could put your academic success in jeopardy due to missing up to 2 weeks for each quarantine period. Not only are you missing out on the in-person education that you are paying for now, if you fail classes, you'll have to take them again, which could put you a semester or more behind on graduating. This could cost students or parents a lot of money, or even mean you won't be able to finish your degree. While we know that with the Delta variant, that vaccinated individuals can still spread the virus due to higher viral loads, and this was not the case with earlier strains, the more vaccinated and mask-wearing individuals we have, the better we can slow the spread, and the better our chances of suppressing the COVID-19 pandemic, not only here in Laramie, but in Wyoming, in our hometowns, the places we want to visit, and the rest of the world. So folks, let's mask up and get vaccinated.